Prescription painkillers or opioids have important medical purposes, but their abuse is on the rise. The members of the American Society of Anesthesiologists, many of whom are pain medicine experts, want to ensure that patients in need continue to have access to these pain medications.
The availability of opioid medications is important for pain patients. In many cases, these drugs make it possible for these patients to regain function.
Without these medications, I don't think I'd be able to get up in the morning.
But now, a recent study showed that prescription drugs are the second most abused category of drugs after marijuana, and she worries the trend may impact her ability to access the medication she needs.
The thought that there are people out there abusing these medications and could potentially affect my access to a life-changing treatment is extremely frustrating for me.
Many people don't realize that prescription drug abuse is just as dangerous as illicit drug abuse. It is not okay to share medications with a family member or to use a drug prescribed to a friend. Taking these medications without a prescription can cause addiction, other illnesses, and even death. The only person who should be taking these drugs is the person they are prescribed for by a physician.
A study from the Substance Abuse and Mental Health Services Administration in 2009 found that 70% of people who use prescription pain relievers non-medically got them from friends or relatives, while approximately 5% got them from a drug dealer or the internet. If you are a patient using these medications, you can help prevent abuse and diversion of prescription painkillers by locking them up instead of leaving them in an open medicine cabinet. Keeping the fact that you are on the medication on a need-to-know basis. Never sharing medications with family members or friends. Only obtaining medications through a licensed physician. Talking with your children about the dangers of prescription drug abuse. The federal government now has a prescription drug abuse prevention plan that includes education of teens and parents on the dangers of prescription drug abuse. It also focuses on educating the public on how best to dispose of these medications.
Patients should dispose of unused, unneeded, or expired prescription painkillers carefully. It is very easy for these medications to fall into the wrong hands. If you have a drug disposal program in your community, that is the best option. If not, patients should plan on flushing leftover opioid medications down the toilet.
While not the best option from an environmental standpoint, concerns about diversion are currently forcing this guidance. However, as part of the federal government's work on curbing prescription drug abuse, the government is planning to partner with local organizations to provide more drug disposal programs in the future. And remember, your doctor is there for you as a resource for patients who take these medications. Consult your pain medicine physician to learn more about responsible use and disposal of opioid drugs. For more information on pain medicine, please visit lifeline2modernmedicine.com.